August 11th, 2025, should have been a day for the Centers for Disease Control to grieve, to regroup, and to begin the painstaking work of healing after an unthinkable tragedy. Instead, it turned into a headline circus when Robert F. Kennedy Jr. decided to show up, striding through the front doors of the CDC as if he hadn't spent years undermining the very institution he was now pretending to honor with his presence. CDC employees weren't having it. Not one bit. Workers, scientists, researchers, doctors, nurses, many still shaken from the August 8th attack that left a respected police officer and veteran dead, and their workplace riddled with bullet holes, have made it clear Kennedy is not welcome. They've called for his resignation, and their reasons are painfully clear. They believe, and said so outright, that if Kennedy and the president hadn't been spreading misinformation about vaccines, downplaying their life-saving effectiveness, and failing to acknowledge the hundreds of thousands of lives saved in the U.S. and abroad, the events of August 8th might never have happened. In their view, his rhetoric has fueled a climate where public health workers are vilified, threatened, and in too many cases, driven from their jobs entirely. And they're not wrong. Since COVID began, dedicated experts have faced credible, targeted threats. Many have left the CDC altogether, not because they stopped caring about public health, but because the hostility became unbearable and deadly. The shooter's rampage didn't just take a life. It shattered the sense of safety inside one of America's most vital public health institutions. Replacing the windows will take months. Replacing the trust? That could take years. Which begs the obvious question, why was Robert F. Kennedy Jr. there at all? Why insert himself into a scene of mourning and outrage when his own words, policies, and actions have done so much to till the soil for exactly this kind of tragedy? Kennedy knew full well he had seeded the ground to produce this result. His appearance wasn't just tone deaf. It was a deliberate provocation. Public health workers aren't mincing words. Kennedy's tenure should end now. The U.S. Department of Labor requires that employers provide a safe work environment. As a government leader, Kennedy is bound by that same standard. And yet, every time he opens his mouth to vilify CDC workers, he makes their jobs more dangerous. These are scientists. These are physicians. These are nurses. These are people whose work has literally saved lives. Kennedy is none of these things. By his own admission, he knows nothing about healthcare, and yet he's in charge of public health for the entire country. Let that sink in. To make matters worse, Kennedy didn't just show up uninvited. He showed up fresh off a decision to cut funding for COVID research and other respiratory illnesses like RSV, even as COVID cases are on the rise along the eastern seaboard. This wasn't a mild uptick. This is a steady climb, a sign that the virus is actively spreading. And Kennedy's answer? Pull the plug on research that could save lives. So here's the question every American needs to ask. Why would the man tasked with protecting public health deliberately cut funding for research on a virus we know is deadly, mutates frequently, and requires updated vaccines to fight new variants? Is this negligence, ideology, or something more sinister? The mainstream media might be too timid to press him on this, but you don't have to be. Email him, tweet him, post on Facebook, show up in the comments section. Because we deserve answers. We all want to be healthy. We all want to be safe. We all pay taxes, and that buys us the right to expect protection from our leaders, not contempt. Robert F. Kennedy Jr. owes the American people, and especially the workers of the CDC, more than platitudes and photo ops. He owes them safety. He owes them honesty. And most of all, he owes them accountability. This is Sensible Sue, signing off. Keep it sensible out there, y'all.